If you are over 60, chasing 120 over 80 may not always be the safest goal. In some people, it may increase dizziness, falls, and even confusion. So today, on Health Decode, we decode what the number really means after 60. For decades, 120 over 80 has been treated as the gold standard for blood pressure. It appears on posters, clinic charts, health apps, and home blood pressure machines. The message became simple: lower is better. Normal is 120 over 80. But health is rarely that simple, especially after 60. The 120 over 80 standard came largely from population studies involving broad adult groups. These studies helped identify risk patterns across younger and middle-aged adults. They showed that higher blood pressure increases stroke, heart attack, and kidney disease risk. That part is absolutely true. So let's pause and decode this carefully. The number matters, but the body behind that number matters just as much. The older body is different. Arteries become stiffer, balance can become less reliable, medication effects can become stronger. Blood flow to the brain may also be more sensitive to sudden drops in pressure. So a number that looks ideal on paper may feel very different in real life. Let me tell you about Margaret. She is 72, active, careful with her diet, and proud of doing everything right. Her home blood pressure readings were often around 138 over 78. She worried because they were not 120 over 80. So her medication was adjusted and her numbers came down. On paper, that looked like success. But Margaret began feeling lightheaded when standing. She stopped gardening because she felt unsteady. One morning, she nearly fell walking to the bathroom. Her blood pressure was lower, but her daily life was worse. Stories like Margaret's are why researchers began asking a more careful question. Not simply, how low can we go? But what level gives benefit without creating avoidable harm? That question changes everything, because the goal is not just lower numbers, the goal is safer, stronger living. One important study often discussed is SPRINT, published in the New England Journal of Medicine. SPRINT compared intensive blood pressure treatment with a more standard target. The intensive group aimed for systolic pressure below 120. The standard group aimed for below 140. SPRINT found fewer major cardiovascular events in the intensive group. That finding mattered, and it changed conversations around blood pressure control. But SPRINT used very standardized measurement methods. Its results do not apply equally to every older adult in everyday clinic settings. And the story did not end there. Intensive treatment also came with more side effects in some participants. These included low blood pressure, fainting, electrolyte problems, and kidney-related concerns. For older adults, those side effects are not small details. A fainting episode can mean a fractured hip. A dizzy spell can mean losing confidence to walk outside. A medication burden can mean fatigue, confusion, or poor sleep. This is where Health Decode wants you to stay calm. Evidence is powerful, but it must be matched to the person in front of the doctor. This is why guidelines moved toward individualized targets. The American College of Cardiology and American Heart Association lowered the hypertension threshold to 130 over 80. But they also emphasize overall risk, age, frailty, side effects, and shared decision-making. In other words, numbers matter, but people matter more. Now, before the revelation, let me be very clear. Only your doctor can set your personal blood pressure target. Your target depends on your risks, symptoms, medications, kidneys, balance, and medical history. Here is the important idea: for some older adults, clinicians may consider a less aggressive target, often in the 130 ends. That is especially true for people who feel dizzy or have fall risk. Systolic means the top number. It is the pressure when your heart pushes blood out. For some older adults, the 130 may balance protection with stability. It is not a magic number for everyone, but it is a range many cardiology discussions now take seriously, especially when chasing 120 leaves someone weak, dizzy, or foggy. The key is context. A fit 62-year-old with high stroke risk may benefit from tighter control. An 80-year-old with falls, kidney issues, or lightheadedness may need a gentler target. Two people can have the same blood pressure reading and need different strategies. That is not contradiction, that is personalized risk management. Blood pressure is not just a number on a machine. It is a measurement inside a living person. The safest target must protect the heart, brain, kidneys, and day-to-day function. So let's pause and decode this carefully. The number matters, but the body behind that number matters just as much. So what can you do starting this week? First, measure your blood pressure correctly. Sit quietly for 5 minutes before taking a reading. Keep your feet flat on the floor. Support your arm at heart level. Use the correct cuff size. Take 2 readings, 1 minute apart, and record the average. Do not judge your health by one rushed number. Blood pressure changes with stress, sleep, caffeine, pain, and even conversation. Second, track trends, not panic moments. Write down morning and evening readings for 7 days. Then look at the pattern. A weekly average is far more useful than a single dramatic reading. Bring those numbers to your healthcare professional. Include symptoms like dizziness, tiredness, falls, or brain fog. Those symptoms are data too. Third, reduce sodium gradually. Salt can raise blood pressure, especially in people who are salt sensitive. Most sodium comes from packaged foods, restaurant meals, sauces, breads, and processed meats. Start by checking labels. Choose lower sodium versions when possible. Use herbs, garlic, lemon, vinegar, pepper, and spices for flavor. You do not need a joyless diet. You need a sustainable one. Fourth, walk consistently. A brisk walk improves blood vessel function, insulin sensitivity, mood, and circulation. Even 10 minutes after meals can help. If balance is a concern, walk with support, use safe shoes, or choose an indoor route. Consistency beats intensity. The best exercise is the one you will repeat. Let me tell you about Margaret. She is 72, active, careful with her diet, and proud of doing everything right. Her home blood pressure readings were often around 138/78. She worried because they were not 120/80, so her medication was adjusted and her numbers came down. On paper, that looked like success. But Margaret began feeling lightheaded when standing. She stopped gardening because she felt unsteady. One morning, she nearly fell walking to the bathroom. Her blood pressure was lower, but her daily life was worse. Many people over 60 are frightened by every number above 120. But fear is not the best guide. Evidence is better. Patterns are better. A thoughtful target is better. The aim is not perfect numbers. The aim is fewer strokes, fewer falls, clearer thinking, and a stronger daily life. A blood pressure plan should help you live better, not simply look better on a chart. That question changes everything, because the goal is not just lower numbers, the goal is safer, stronger living.